today. All right, Dr. Scott Sanders from Balance MD. Good to see you again. I know last time, it seems like we always focus on vertigo and dizziness. That's what you guys do. But I think there's a connection to migraines that people may not realize. Tell me about what the connection is.
Sure. So migraine is a common condition that affects many people in the country, 20–25% or so. And somewhere between 30 and 40% of those people will actually experience dizziness or vertigo as part of their migraine symptoms. And the difficulty in arriving at this diagnosis is because the symptoms vary from person to person, and often people have the dizziness and vertigo or balance issues without headache.
Okay, and so that being the case, if we back up just a bit, I bet oftentimes this is misdiagnosed.
It is.
Okay.
It's not uncommon for patients to see multiple healthcare providers, have testing, MRI scans, CAT scans, carotid Doppler studies, and be treated with antibiotics for presumed inner ear infection and that sort of thing. And none of that ever really shows what the cause is or helps treat the symptoms.
Well, so consequently, these folks are still dealing with migraines, and it's just a specific type of migraine that's causing the dizziness and the vertigo?
We call it either a vestibular migraine,
Okay,
which means an inner ear sort of symptom of migraine, or migraine-associated dizziness, meaning that it's associated with a migraine mechanism, but often headache is absent.
Okay, so okay, there you go. So that's why it can be maybe confusing not only for physicians but also for the patient, because they're thinking, I don't suffer from headaches.
Exactly.
So what's the problem here? And then you tell them
Exactly.
they suffer from migraines. Okay, I imagine there's a lot of explanation that takes place.
There is. There's a lot of doubt initially.
Right?
And many people, when they do have headaches, they describe them as more of a sinus headache.
Okay.
Headaches that occur when weather changes, and those are actually migraine.
Oh, no kidding. Okay, so what sort of treatment options would somebody be faced with after they've been properly diagnosed, finally?
Sure.
Then what do they do?
Well, there are triggers for these
Okay.
kind of symptoms. I think we have a slide that shows some of these triggers.
There they are.
Dietary things, red wine, nuts, cheeses, processed foods that have nitrates in them, foods with monosodium glutamate, and aspartame and Diet Cola are some of the major triggers. If you can avoid those, or avoid whatever it is that might be triggering your symptoms, then that's often very helpful. Adequate sleep is huge. People who don't get enough sleep, that's often a trigger.
Okay.
And there are preventative medications that we use.
Okay.
And they're often simple, well tolerated, and inexpensive.
Oh, fabulous. And then I know you've got a testimony, too, that you're going to share with us, and I'm sure more than one patient could say this.
We have a lot of these. Patients will write in and thank us for coming up with what is causing their symptoms and express to us how much better they feel. And in some cases, it's a life-altering event. People have been unable to work, unable to drive their car because of this, and they're finally able to live their life.
Fabulous. Well, if somebody wants to reach out, what's the best way for them to do that? Call your office?
Sure. We have a toll-free number, 888-888-3499, which is also 888-888-DIZZY.
That makes it very easy, doesn't it?
We also have a website with a lot of information on it, www.balancemd.net.
Okay, there you go. So if you guys are dealing with dizziness or vertigo, it could be a migraine, even though you don't have a headache. So call these guys, get checked out, find out what's causing all that discomfort so that you can move on with your life and feel better. Thank you very much, Doctor.
Thank
Good to
you.
see you. All right, next up, we're going to talk about why you might want to choose Chicago for your next